from the clip we saw, your intern year or your first year there at residency, it seemed to be really stressful and overwhelming, and you used the term burnt out, and it kind of seemed that that sort of environment might not be sustainable, but you've stayed in the environment and continued to care for this underserved population. So how have you managed to balance the stress and work with your personal life?
That's a really great question. So my patients always say, "Are you going to leave sometime? Are you going to leave?" And I say they'll probably take me out in a coffin. I think internship is really hard. I think, Jay, the clip you showed of him, it was, it's just hard wherever you go. So I thought it was really interesting. About 6 months after I finished my residency, when I didn't have the overnight calls and things, like all of a sudden I sort of became myself again. And so I think just not, having some weekends free and being able to catch up on your sleep sort of brings you back to yourself. So I think sleep deprivation and time off really makes a difference. Actually, I do want to say one thing, which is that watching yourself on a 10-foot screen makes you want to run to a plastic surgeon right away. or a good dermatologist. So if anybody knows one, let me know.
Thank God it wasn't in high definition.
Well, I definitely have more questions, but now let's open up the crowd. So there's a person up here who would like to ask a question. I think a microphone will come around to you, sir.
So I have two questions to Jay and Jane. If you could design training for doctors differently, what would you want to see done differently than your training? And what would you say to the Obama administration on how healthcare should be reformed? Two small questions.
Jane's given me the option of going first. I can't imagine why. Can you hear me all? I actually would think about changing healthcare before healthcare education. I think the big issue is, what does the healthcare system in the United States look like? And if we fix it, I think the people who go into it are going to know what they're getting into, and I think education will probably be a part of that. It's going to have to fit into whatever the world is going to look like. I think we desperately need to think of healthcare as a right and not something that some people get and other people don't. To me, it's appalling, actually. But there's a lot that's appalling about the world, so I don't know whether it's going to get fixed or not anytime soon. I'm hopeful about Obama being elected. I really hope he can make things happen.
I would say that when you design a system, you get the product that you designed for. And we've designed a system where people who have high technology, no offense to anybody, because I know this is technology, we all like technology, but where you get rewarded for high technology, where you get rewarded for invasive procedures, where you get rewarded for sort of the shiniest and newest thing, and you don't get rewarded for prevention. And that's why, I work in a hospital. Hospitals have so much power. People who are interested and systems that are interested in prevention are really very, very low on the totem pole, and I think it's because we designed a system that way. So if I were to redesign the system, that I hope, and I think that Obama has the ear. Some of the people I actually know from my experience in primary care are very close friends with Obama. In fact, one of his close friends is a guy who I know through my professional work, is a physician in Chicago, and he's really public health minded. So I'm hoping that Obama has been learned and swayed by that. So, and I think you see a lot of people are really interested in universal health care. And the reason they're interested in universal health care is so that we can have the same sort of expensive health care where a lot of people make a lot of money off of the insurance, whereas why don't we just have universal health care where we as the public will benefit and we will put public priorities. And part of the reason why I chose to do the film is because I certainly have political views, which I were hoping, and my sort of view of medicine might hope get on the film. So you've heard it.
What do you think is the function of having the internship and the residency structured the way it is, with the number of hours and the number of hours and the intensity of the work, especially given what you indicated is the degradation of the service. I'm just puzzled about why you think it's structured that way.
So I think that you have to look, and I'm not a historian, and I don't know if there's a historian in the audience, but I think you have to look at the historical roots of internship and residency. They really were clinical apprenticeships. And it was a time when you didn't have, maybe not have beepers, patients were in the hospital for 2 weeks at a time. And it was a very different pace, a very different, the technology, the interventions were much fewer. And so I think that maybe it was more reasonable at a certain time when it started. And then as medicine grew over the years, I think the structure didn't really keep up with the changes. And there's been a lot of attempts to change it, and I'm hoping that they will continue to grow. But the question is, how do you get young doctors to have exposure, clinical exposure? You need to see a lot of patients to learn. And so how do you do that within the structure and have people sleep? And I will also say one other thing, which is that Jay and I graduated in 1991, so that was quite a long time ago, and things have evolved since then, at least at Boston Medical Center. Once a week, every resident gets a day off. Of course, the attendings don't get a day off. I just thought I'd say that. We sort of get the vet. And, but also there's a lot of more attention to, night floats, and so that you don't have so many hours on end. So there has been some attention, I think. So you're looking at, sort of one iteration ago in what you see of us. So it's not exactly what's happening today.
Ditto.
You don't have to. You're a guest. Okay. Just like mine.
Do you agree with what I said? Somewhat?
I completely agree with what you said.
Okay.
You know, we have Nancy Oriel here, who's a dean at Harvard Medical School, so I just kind of, she's a guest, but, I thought,
Yes.
she might want to make a comment.
So thank you very much to both of you for participating, and thank both of you for putting this out there for the public to see. And Jane's right, life is better. But the transition that you go through, the sort of the growth that you have to experience to go from being a pre-med student to being a doctor is well portrayed. And that's something that's actually very important for people to understand. It's not just, another day in the office. And I think you did an excellent job and a very sensitive job of showing the transition in a way that makes me proud of you guys. So thank you.